Hello everyone, I am Abby, a renal nurse. Ever wondered what your kidneys do when you're not looking? Well, they're the unsung heroes of your body, working tirelessly to keep you in tip-top shape. These little bean-shaped organs filter out the bad stuff from your blood and kick out the extra fluids, keeping everything in balance. Think of them as your body's very own cleanup crew. But what happens when the cleanup crew goes on strike? When kidneys fail due to disease or injury, waste and fluids start piling up like an uninvited guest at a party. That's when dialysis steps in to save the day. Dialysis is like having a superhero sidekick for your kidneys. It takes over the heavy lifting, filtering out toxins and keeping your body in check. Imagine a mechanical assistant that steps in to do the dirty work when your kidneys can't. That's dialysis for you. It filters and removes waste products and excess fluids from your blood, keeping everything in balance. This process is a lifesaver, literally. Regular dialysis sessions can make a world of difference, improving the quality of life for those with kidney failure. It's like hitting the refresh button on your health. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Each has its own unique way of giving your kidneys a helping hand. Each type comes with its own set of perks and quirks. Knowing the differences can help you pick the best fit for your lifestyle and health needs. Understanding these options is key to making informed decisions about your treatment. It's all about empowering yourself to take charge of your health journey. Welcome to the world of hemodialysis, where your blood takes a little field trip outside your body, usually to a dialysis center. During this adventure, blood is drawn from your bloodstream and sent on a thrilling ride through a dialyzer, also known as an artificial kidney. Picture this. The dialyzer is like a high-tech sieve with thousands of tiny filters, sifting out waste products and excess fluid from your blood. Think of it as a superfine mesh that separates impurities from water. The dialyzer does the same for your blood, making it squeaky clean. Once purified, the blood returns to your body, completing its round-trip journey. This escapade happens 3 times a week, with each session lasting about 4 hours. Plenty of time to catch up on your favorite shows. This regular schedule keeps waste products and fluids in check, helping you stay as healthy as possible. Before each session, patients step onto the scale to see how much fluid they've gained since their last treatment. Think of it as a pre-game weigh-in. Next up, a nurse or technician gets the dialysis machine and the patient's access point ready. It's like prepping for a high-tech spa day, but with a fistula or graft in the arm. Once everything is set, 2 needles are inserted into the access point. One to take the blood out for a cleanse, and the other to return it, all fresh and filtered. These needles are hooked up to the dialysis machine via tubes, letting the blood flow through the dialyzer like a mini car wash for your bloodstream. During the treatment, patients can kick back, read a book, catch up on their favorite shows, or even take a nap. It's me time with a medical twist. Throughout the session, the dialysis machine keeps an eye on the patient's blood pressure and heart rate, making sure everything runs smoothly. After the session, the needles are removed and the access point is bandaged up. It's like wrapping up a successful mission. Patients can usually get back to their regular activities right after the treatment, feeling refreshed and ready to go. Why rely on a bulky machine when you have a built-in filter? Enter the peritoneum, the unsung hero of your abdominal cavity, ready to save the day. With PD, you can ditch the clinic and dialyze in your PJs. Home sweet home just got a whole lot sweeter. The magic happens when a sterile solution called dialysate is introduced into your peritoneal cavity through a nifty little catheter. Think of the peritoneum as a bouncer at a club, letting waste and excess fluid out of your bloodstream and into the dialysate. Once the dialysate is full of those unwanted guests, it's drained from your body, leaving you feeling refreshed and ready to go. The best part? You can do it all while catching some Z's. Nighttime dialysis means you wake up ready to seize the day. Say goodbye to frequent clinic visits and hello to more me time. PD gives you the freedom to live life on your terms. When it comes to peritoneal dialysis, you've got 2 main players on the field: continuous ambulatory peritoneal dialysis, or KAPD, and automated peritoneal dialysis, or APD. Think of them as the dynamic duo of dialysis. KPD is the hands-on method where you become the master of your own dialysis destiny, performing exchanges manually throughout the day, usually 4 times. It's like having a flexible job, but you need to stick to a schedule and be diligent with the process. APD, on the flip side, is the tech-savvy option, using a machine called a cycler to handle the exchanges for you. The cycler works its magic while you catch some Z's, freeing up your daytime for other activities. APD is all about convenience and automation, but you'll need to commit to the nightly routine with your trusty machine. Choosing between Kia PD and APD is like picking between a manual and an automatic car. Each has its perks, depending on your lifestyle and medical needs. Chatting with your healthcare professional can help you decide which method is your perfect match. Alright folks, let's dive into the nitty-gritty of getting you all set up for dialysis. First up, for hemodialysis, we need a fancy access point, surgically crafted by our skilled vascular surgeons, usually in the arm. This access point can be a fistula, a graft, or a catheter. Each has its own perks and quirks, so choose wisely. Now, for peritoneal dialysis, we go a different route. A surgeon implants a catheter into your peritoneal cavity, creating a VIP entrance for dialysate exchanges. Once your access point is good to go, it's training time. You'll learn how to master your dialysis method like a pro. This includes getting cozy with the dialysis equipment and procedures, learning how to keep an eye on your vital signs and spotting any red flags, managing your meds and dietary restrictions like a champ, and keeping things squeaky clean to avoid infections. With thorough training and ongoing support from your healthcare dream team, you'll be managing your dialysis treatment like a boss and staying on top of your well-being. Dialysis, a lifesaver, but not without its quirks and lifestyle twists. Whether you're Team HD or Team PD, expect some fatigue, muscle cramps, blood pressure roller coasters, and the occasional itch. But fear not. These side effects can often be tamed with the right meds and a few lifestyle tweaks. Hemodialysis, with its on-again, off-again nature, can mess with your fluid and electrolyte levels, leaving you feeling like a deflated balloon. Peritoneal dialysis, the more flexible option, comes with a catch: slack on hygiene, and you might end up with peritonitis. Both methods demand dietary discipline. Think less fluid and a hard pass on foods high in potassium, phosphorus, and sodium. Stick to these rules and you'll keep your fluid balance, electrolytes, and overall health in check. Alright folks, let's dive into the deliciously complex world of dietary and fluid management for dialysis patients. It's not just about what you eat, but how it can make or break your dialysis game. Get it right, and you're on the path to feeling fabulous. When your kidneys decide to take an extended vacation, waste products and fluids start throwing a party in your body. Spoiler alert, it's not a fun party. So we need to crash it by watching what we eat and drink. First up on the menu, potassium. This sneaky little mineral is hiding in your favorite fruits and veggies. Too much of it, and your heart might start doing the cha-cha. So, let's keep it in check, shall we? Potassium is like the DJ of your body's dance floor, keeping your heartbeat and muscles grooving. But remember, balance is key. Too much bass and the party's over. In high doses, potassium can turn into a party crasher, causing irregular heart rhythms. That's why we need to keep an eye on it, like a hawk watching its prey. Say goodbye to bananas, oranges, tomatoes, and potatoes. These potassium-packed goodies might need to be limited or even avoided. But don't worry, your healthcare team will help you find tasty alternatives. Next on our hit list is phosphorus. This mineral loves to hang out in protein-rich foods and can mess with your bones if you're not careful. High phosphorus levels can turn your bones into brittle twigs and increase your risk of heart disease. So, let's keep phosphorus in check and your bones strong. Dairy products, red meat, and cola drinks are phosphorus-packed culprits. Time to find some low-phosphorus alternatives and keep your bones happy. Now, let's talk fluids. Dialysis patients need to be fluid ninjas, carefully managing their intake to avoid complications. Too much fluid, and things can get messy. Since your kidneys are on strike, limiting fluid intake helps prevent fluid overload. This can lead to high blood pressure, shortness of breath, and swelling. Not fun, right? Teaming up with a renal dietitian is like having a personal coach for your diet. They'll help you craft a meal plan that meets your nutritional needs while keeping those pesky restrictions in check. By sticking to the recommended diet and fluid guidelines, dialysis patients can manage their condition like pros and enjoy a better quality of life. So, let's raise a glass, of water of course, to better health and a more fulfilling life. Deciding between hemodialysis or HD and peritoneal dialysis or PD is like choosing between two very different lifestyles. Each has its own quirks and perks that can make a big difference in your daily life and overall well-being. HD is the social butterfly of dialysis treatments. With its centralized approach, you get the VIP treatment from a dedicated healthcare team. They're there to pamper you and jump in if anything goes awry. Patients on HD enjoy personalized care and instant attention if complications arise. It's like having a medical safety net, giving you peace of mind. But HD does come with a catch. You'll need to visit the dialysis center 3 times a week. which can throw a wrench in your daily plans and limit your flexibility. Not ideal if you're juggling a busy schedule or have transportation issues. Enter PD, the independent spirit of dialysis. This method lets you take the reins and perform dialysis at home, giving you the freedom to set your own schedule. With PD, you can often do your dialysis while you sleep, freeing up your days for work, hobbies, or just enjoying life. It's all about flexibility and living life on your terms. PD also offers a gentler filtration process, which can mean fewer dietary restrictions and better blood pressure control. Perfect for those who love their food and need to keep an eye on their health. However, PD isn't all sunshine and rainbows. It demands a high level of self-management and strict hygiene to prevent infections. You'll need to be a cleanliness guru to keep complications at bay. Ultimately, the best choice boils down to your personal needs, lifestyle, and medical suitability. Weighing the pros and cons of each method is key to making the right decision. Factors like your overall health, other medical conditions, and the support systems you have in place are crucial in picking the right dialysis method. Consulting with healthcare professionals and considering your unique circumstances will guide you to the best choice. Dialysis, the unsung hero of kidney failure, brings with it a world of choices and lifestyle tweaks. Knowing the ins and outs of dialysis types, their routines, perks, and quirks is key to making savvy health decisions. Hemodialysis gives you the VIP treatment in a clinical setting, while peritoneal dialysis lets you be the boss, offering more freedom and flexibility. The dialysis journey can be a roller coaster, demanding adaptability, grit, and a solid support crew. Keeping the lines open with your healthcare squad, nephrologists, dialysis nurses, and dietitians is crucial for tackling concerns, setting realistic goals, and mastering the treatment maze. Remember, knowledge is your superpower. By staying in the know about dialysis, patients can take charge of their care, voice their needs, and aim for the best quality of life possible. Thanks for watching this video. Share, like, or comment if you found this video useful.